headline to sink the heart, announcing the temporary suspension in South Africa of the Oxford AstraZeneca vaccine.
To me, it's just a disappointment.
The Soweto resident saying they'd been looking forward to the vaccine setting them free. A study released yesterday found the Oxford University jab had minimal effect in preventing mild disease caused by the strain, suggesting vaccinated people may still be able to catch it and spread it. There are questions around the announcement. It is a small study involving 2,000 mostly young and healthy people. And the government has already received its first 1 million doses. They'd been destined for healthcare workers. A World Health Organization briefing late this afternoon, and a South African government advisor said they were unclear about the vaccine preventing severe disease and hospitalizations.
And one proposal that's currently being considered is to roll it out initially just in a stepped manner, where the first step includes about 100,000 individuals that are vaccinated, in which we monitor the hospitalization rates.
Otherwise, he said, they would need to look for alternatives. The hunt for the coronavirus variants continues in England. Surge testing added to new sites in Worcestershire, Sefton and here in Bristol and South Gloucestershire.
What we're doing here is testing asymptomatic people from those defined areas where there are cases and ensuring that we stay on top of the spread of the virus.
Today at the Downing Street press conference, however, they sought to reassure the public over the South African variant.
Early data on modelling does not suggest that the South African variant has a distinct transmissibility advantage over our current virus. And because of that, there is no reason to think the South African variant will catch up or overtake our current virus in the next few months.
Which means there is time for the vaccines to be tweaked and for decisions to be made about booster shots. Today, the government extended free lateral flow testing to businesses in England with more than 50 employees. Indeed, the second person they tested here was positive, but asymptomatic.
That person would have gone on to manufacturing cell work with a dozen other people, and it could have been very serious, but he's picked up straight away.
And yet, despite the ramping up of testing, there is clear evidence across the country that they are scaling back on the very people needed for contact tracing. We were sent this from a staff member at one call centre, making clear that they'd only last week received some reassurance that they would be involved in test and trace until May. The email went on to say, unexpectedly, we received a communication to say that due to the government reducing supplier numbers, this will no longer be the case as of the 12th of February.
You've just described the testing programme as growing at a blistering rate, and you've praised contact tracing, and yet there are numerous reports of contact tracers at call centres being made redundant.
We're putting more resources into the areas where we have significant concern, where there's a variant of concern. So it is performing absolutely brilliantly, and I'm very, very proud of all the people who are doing that. And the good news is that also, because the number of cases is coming down, so the number of people who are positive, and therefore the number of contacts, is also coming down too.
We also put this question to Citl and Serco, who run some of the call centres. They did not respond. The Department of Health and Social Care said clinical outcomes are always our first priority, and they said that they are working hard to ensure their services represent value for money.
And Victoria MacDonald is in the newsroom now. Victoria.
Well, just on those redundancies, I don't think the Health Secretary entirely answered my question. And the fact is, these contact tracers are largely zero-hour contractors who would have been expecting to be employed for longer. It remains unclear why this is happening, except that numbers are falling, though we know those numbers can go back up again.
And what about today's vaccination figures, Victoria?
Yes, well, more impressive figures today on the vaccine rollout, 12.2 million, and a message from the Health Service in England. People over the age of 70 who have not yet been offered an appointment can now ring up and arrange one for themselves. This is a change. Until now, they've had to wait for their email or call, but they are saying this has changed. The messaging will go from "we will contact you" to "contact us." But I have to remind you that it is only those over the age of 70 and those top 4 priorities. The target for vaccinating all those in those top 4 groups is next Monday, and it does look as if it will be hit. So that's about 15 million people. There were some figures today too saying that 91% of all over 80s and 93% of eligible care home residents have received at least their first dose, which is impressive. As they said themselves, they thought they would get take-up of around 75%.
Victoria, thanks very much. Well, earlier I spoke to Professor Sir John Bell from the University of Oxford, and I began by asking him how sure he could be that the Oxford AstraZeneca jab offered protection against serious illness from the South African variant.
So we're pretty sure that it offers prevention against serious disease against the other variants, the Victoria strain and the Kent strain. What we don't know is whether it offers protection against the South African variant. And the reason is that we had, because of the nature of the study that was done in South Africa, which was a very small study done in very young people who, 30-year-old, I think, were the average age, they don't get serious disease. They didn't get serious disease, so we can't really make a comment on that. What I think you can say, though, is that for the Janssen, the J&J vaccine, which is exactly the same format, a slightly different adenovirus vector, they did study their vaccine in older patients with serious disease and had good evidence that it protected in that setting.
So that is a theoretical assumption you're making. And I just wonder, for people, particularly elderly people who've already had the Oxford AstraZeneca vaccine, they might be pretty concerned that there could be further evidence to come out within the next few weeks that suggests that they're not protected from serious illness against that South African variant.
Yes, I don't think I can deny that. I think there may be evidence that comes out. I think what everybody needs to know is that the South African variant is a very different type of virus than any of the vaccines have been used against, and is also a virus which has the ability to infect people who've had the original strain of the virus, who've had an infection with the original Victoria strain. So if you had an infection in the summer, for example, or in the autumn, and you ran into the South African variant, the conventional wisdom is you'd be protected against the disease. But I think the evidence is growing that you would not be protected against that.
But given that you admit that there is not the data on the Oxford AstraZeneca vaccine yet in terms of serious illness, have the South African government therefore made the right decision to suspend the rollout of that vaccine? Should we do the same? Should we consider that?
No, so you have to understand, we don't have very much South African variant in this country. We're trying to combat the Kent and the Victoria strain. The AstraZeneca vaccine is perfectly good for both Kent and Victoria. In fact, its data, as you know, released last week, 80% protection when you have 2 doses at a 12-week interval, 71% protection with a single dose. It's a great vaccine against the existing strains in the UK.
So aren't the vaccines always going to be playing catch-up? You can't do a booster, for example, until the autumn, can you? So that's a problem, isn't it?
Well, so there are several ways to deal with the new variants. And you're right, we are going to be chasing variants pretty continuously. One is that we're really only at the beginning of the journey to try and optimize the effectiveness of the vaccines. And one of the interesting ways to potentially really increase both the breadth of the immune response and the depth of the immune response is to mix the vaccines in different combinations. So adenovirus plus mRNA, protein-based vaccines plus adenovirus, mRNA plus whole virus, and you can do all those things. And the initial data that we've got from a few small studies is that you can dramatically increase neutralizing antibody levels, which is one of the markers that we use to detect whether they're working well. Those experiments take no time at all. They take a couple of weeks to do. So we should get a much better idea about how we can optimize our immune responses. And that might in its own right be enough to allow us to blast through at least the first cascade of variants and maybe more. So we've got lots of tricks up our sleeves that we can play, I think. And so that's another reason why I'm fairly confident we'll get on top of this.
But definitely no booster available until the autumn. You can't do it quicker than that.
Well, I think everybody needs to be, it's the old problem, don't overpromise. So let's just see. There's a lot of work going on at the moment. Heterologous combinations may solve the problem in the short term. We may get a booster before then, but what is also interesting is this virus looks pretty seasonal. I was a skeptic about that a year ago, but it does look like it comes and goes with the seasons. So as soon as we get to spring and summer, we may get another very substantial lull in transmissions and the likes. It's what's going on in South Africa at the moment, interestingly, is that the disease numbers are way down in South Africa, despite the famous South African variant. So I think there are lots of different things at play here.
Professor Sir John Bell, thanks very much.
You're welcome.
And in the last few minutes, the Department of Health says that more surge testing will take place in a number of areas around Manchester where a COVID variant has been found. People living in the postcodes they've listed are strongly urged to take a COVID test this week to see whether they have symptoms or not.